Hello everyone, I'm Dr. Abhinav. So the first question is, a 60-year-old man comes to the emergency with history of chest pain, which is acute onset. ECG shows STE depression and T waves inversion. Biomarkers are not elevated. What will be the appropriate management? So this question, when I saw this question, it was quite confusing. So initially I thought of it might be Prince Metal's angina, but it can also be unstable angina. So this is important thing is that there is no infarction. It's only ischemia. So since the patient is having chest pain, anyway, sublingual nitroglycerin should be given. So in this 4 option, there is only 2 options with sublingual nitroglycerin. So out of these 2 options, since there is no infarction, will not give streptokinase. And so I'll go with the option D, oxygen plus sublingual nitroglycerin plus digoxin. Use of digoxin here, I'm not sure why it is given. So if you know, do let me know. The victim is found unconscious in the roadside. As a trained rescuer, after checking the victim's response and pulse, you decide on resuscitation. What is the recommended ratio of chest compression to ventilation during CPR? So the recommended chest compression to ventilation in adults is 30:2. In children with one rescuer, it's 30:2. With two rescuers in children, it's 15:2. Which one of the following is not a differential diagnosis of ST segment elevation in ECG? Acute pericarditis, yes. Trauma, yes. Hypothermia, yes. Hypocalcemia doesn't have ST wave elevation. So which of the following is a non-shockable rhythm in respect to use of AEDs? So ventricular rhythms are usually shockable rhythms, and rhythms like when there is no pulse but there is electrical activity, in those kind of scenes, AED is non-shockable. So ventricular tachycardia and fibrillation can be given, but pulseless electrical activity is a non-shockable rhythm. 50-year-old man presents to emergency with breathlessness, palpitations, acute chest pain. On auscultation, there is systolic murmur at the apex. ECG shows ST elevation in anterior chest leads. So one of the following is the next choice of investigation. So the patient is having typical symptoms of acute coronary syndrome. So this patient is also having ST wave elevation. So what we'll do initially is we'll send for biomarkers, that is troponin T and troponin I, to confirm the diagnosis. So which of the following electrocardiographic findings are manifestations of digitalis intoxication? So digoxin's intoxication can cause ventricular bigeminy, ventricular tachycardia, ventricular tachycardia with variable atrial tachycardia with variable block, but doesn't cause atrial flutter. So the answer is 1, 2, and 4. According to modified WHO classification of heart diseases in pregnancy, which cardiac lesion is a contraindication for pregnancy? In pregnancy, the contraindication is pulmonary artery hypertension. So a patient with pulmonary artery hypertension cannot handle the stress of vaginal delivery, nor can handle surgery such as LSCS. 35-year-old patient presents in the emergency with sudden onset palpitations. His heart rate is 150 and gets reverted after carotid massage. So usually carotid massage is done in the settings of paroxysmal SVTs, supraventricular tachycardia. So 9th question, which one of the following statements is correct regarding opening snap in cardiac auscultation? So opening snap in cardiac auscultation is usually seen in mitral stenosis. So mitral stenosis, the murmur is usually a diastolic murmur. So in this question, the answer is high-pitched diastolic sound. So remember that mnemonic for systolic and diastolic murmurs, what I remember is MRS, ASS. So Mrs. as. So MRS is mitral regurgitation, and the equivalent to is tricuspid regurgitation causes systolic murmurs. And if you see ASS, aortic stenosis, and the same thing such as pulmonary stenosis causes systolic murmurs. So the opposite of it causes diastolic murmurs. So the answer here is high-pitched diastolic sound. A 35-year-old laborer worker consulted a local medical practitioner for recurrent attack of chest pain. His elder brother had similar complaints and died at age 40. The laborer worker was advised to take sublingual nitroglycerin at the time of chest pain. But after taking nitroglycerin, if you see the chest pain has increased in intensity, you know the following is the most likely diagnosis. So here I would go with the diagnosis of hypertrophic obstructive cardiomyopathy, because if you see HOCM is a diastolic dysfunction. So diastolic means there is problem in filling. So when the patient is having problem in filling and you give nitroglycerin, there is vasodilation and there is more blood coming to the heart. So when there is more blood coming to the heart, so it cannot fill because it is having HOCM, which is a diastolic dysfunction. So that is why when giving nitroglycerin, these patients' chest pain gets worse. A patient with AFib on regular treatment presents to photosensitivity, skin discoloration, peripheral neuropathy. Which drug is to be implicated? So the drug causing these side effects is amiodarone. The following are categorized under obstructive lung disease. So obstructive lung diseases means the air cannot go out. So restrictive means the air, the patient is like hungry for air. So patient wants air. But in obstructive lung disease, these patients have air, but they cannot get out of the air. So here the obstructive lung diseases are usually asthma, bronchiectasis, and bronchiolitis. So 1, 2, 3. So pulmonary sarcoidosis comes under restrictive pattern. Risk factors for development of COPD include tobacco smoking, yes; recurrent infection, yes; cold dust exposure, yes; but high socioeconomic status, no. Usually seen in low socioeconomic status. Which one of the following is not an aim of asthma therapy? So peak expiratory flow, yes, true. Less than 20, no emergency visit, yes. Minimal use of ICS, no. So usually when the patient is coming with an asthma, so what we usually initially start is with this inhaled corticosteroids. It is not anymore starting with beta 2 agonists. So the aim of asthma therapy will not be minimal use of inhaled corticosteroids. A 65-year-old male smoker has been diagnosed with COPD on pulmonary function test. FEV1 bar FVC is less than 0.7 and FEV1 is 42% as predicted. Severity according to GOLD criteria is, so 42%, that is severe. Less than 80 is mild, 50 to 80 is moderate, and less than 50 is usually severe, and less than 20 to 30 is very severe. A 40-year-old patient with bronchial asthma presents with acute severe breathlessness. Indications of giving him assisted ventilation for acute severe asthma includes, here the answer is PaO2 less than 60 and PaCO2 more than 45. Which one of the following are the non-metastatic extrapulmonary manifestations of lung cancer? So carcinoid syndrome can be seen, yes; nephrotic syndrome, yes; Horner syndrome, no; Lambert-Eaton syndrome, yes. So if you see Horner syndrome, it is usually seen in the apical tumors. So that is like Pancoast tumors. So that is not an extrapulmonary manifestation of lung tumors. Okay, the extrapulmonary manifestations are 1, 2, and 4. A 60-year-old obese person weighing 110 kgs have been complaining of excessive sleepiness in the daytime, morning headache, irritability, and mood disturbances. Patient also has history of dry mouth, nocturnal heartburn, diaphoresis of the chest and neck. Which of the following will be the best investigation to diagnose this patient? So, reading this history, what I thought was this could be an obstructive sleep apnea because the patient is an obese patient, not sleeping at night, having irritability in the morning. But the thing that bothers me is that the patient is having diaphoresis of chest and neck, dry mouth, nocturnal heartburn. But I would still like to go with the diagnosis of OSA, so I'll do an overnight polysomnogram. Which one of the following does trigger bronchial asthma? Drugs, sorry. Which one of the following drugs trigger bronchial asthma? Sulfonamides, no. Aspirin, yes, can trigger. Okay, ACE inhibitors, yes, can trigger, but because ACE inhibitors are known to cause cough, and they can cause wheezes as well. Beta blockers, yes, because if you have seen the beta agonists are used in treatment of asthma, so beta blockers can cause asthma. A patient with Crohn's disease underwent ileal resection. Which of the following complications may develop in this patient? Oxalate-rich renal calculi, yes. Diarrhea and fat malabsorption, yes. Hypernatremia, yes, no. So answer is 1, 2, 3. Protein losing enteropathy due to obstruction of intestinal lymph vessels is seen in the following conditions. So all these 4 conditions can cause protein losing enteropathy. But what they have asked is which one is causing due to lymphatic vessel obstruction, which is usually which one due to obstruction of intestinal lymphatic vessels. So due to obstruction, the answers are intestinal lymphangiectasia, constrictive pericarditis with heart failure, and Whipple's disease. Eosinophilic gastroenteritis is not due to obstruction of intestinal lymphatic vessels. That is due to other mechanism like diffusion, direct diffusion, So the answer here would be eosinophilic gastroenteritis. Is the wrong answer. So answer is 1, 2, and 4. So now the following virus is associated with development of acute liver failure and high mortality in pregnancy. That is hepatitis E virus, fulminant hepatic failure. Considering the following statements with regard to anorexia of aging. Declining chemosensory function, yes. Reduced efficiency of chewing, yes. Slowed gastric emptying, true. So alteration in neuroendocrine axis, no. Answer is 1, 2, 3. Consider the following statements. Type 1 hepatorenal syndrome is characterized by rapid deterioration in renal function within 1 to 2 weeks, true. Type 2 hepatorenal syndrome characterized by a moderate or unstable or slowly progressive renal dysfunction, true. HRS seen in patients with large ascites in case of cirrhosis. Yes, all three are true. So before going to next question, in this question, please let me know if the alteration in the neuroendocrine axis is also correct or not. So now the following is the serological marker of immunization with hepatitis B vaccine. That is anti-HBs. Infection with which of the following organisms can cause a syndrome which is clinically indistinguishable from achalasia of esophagus? That is Trypanosoma cruzi, so Chagas disease. Consider the following statement in respect of Helicobacter pylori. It is a gram positive. No, this is a gram negative organism. So this answer is wrong. So addition molecule is B correct. Urease enzyme to reduce the pH correct. Gastric type epithelium correct. So answer is 2, 3, and 4. The quadruple therapy regime or OBMT regime for H. pylori is consisting of a PPI, that is omeprazole, bismuth subcitrate, and metronidazole and tetracycline. You see here, these are mainly targeting gram-negative organism, which is H. pylori. So other answers are wrong. Cystic fibrosis is autosomal recessive. Which of the following diseases may be associated with celiac disease? So type 1 diabetes can be associated, but type 2 is not associated. IgA is associated. Downs and Turner's are associated. So answer is 2, 3, and 4. Consider the following statement regarding celiac disease. There is a strong association of the disease with HLA, DQ2 and 8, true. Intolerance to gluten in wheat, dry barley oats, true. In the elderly, disease presents with symptoms ranging from malabsorption, weight loss, true. So suspected patients, small bowel biopsy is contraindicated, no. Usually small bowel biopsy can be diagnostic. So answer is 1, 2, 3. Asymptomatic bacteria is defined as presence of more than 10 to the power 5 organisms per ml in the urine of apparently healthy asymptomatic patients. So it's not 4, 3, or 2, it's 10 to the power 5. Renal transplant offers the best chance of long-term survival in ESRD and is cost effective. Which one of the following is not a contraindication to renal transplantation? Active malignancy is a contraindication. Children less than 1 year is a contraindication. Adults more than 75 is a contraindication. Diabetes mellitus is not a contraindication, rather than is causing a more common cause of end-stage renal disease leading to transplant. So now the following are the mechanisms for anemia and chronic kidney disease. So this, what I found in the books was, it was saying that deficiency of erythropoietin can cause, folate and vitamin B12 can cause, but they haven't mentioned about toxic effects of uremia on bone marrow. They have also mentioned about reduced utilization of dietary. So I'll go with the answer 1, 2, and 4. The leading cause of CKD globally is diabetic nephropathy. Presence of Beaver sign on neurological examination is characteristic of spinal cord lesion. So the following are the level of T9 and T10, which is usually when the patient try to lift his head, his umbilical will move towards his head, umbilicus. So that is Beaver sign is significant of injury at T9 and T10. Which of the following statement is correct regarding lower motor neuron type of lesion? So in lower motor neuron, fasciculations are always present. So here they have given absent, so wrong. Deep tendon reflexes are increased, no, they are decreased. Clonus is present, no, clonus is absent. Plantar reflex shows flexor response, true. So now the following is the single strongest risk factor of dementia, increasing age. Massive retinal hemorrhage with blood and thunder appearance and vision loss caused by central retinal vein occlusion. So it is usually painless and sudden loss of vision. Visual hallucination is characterized by which type of dementia? Usually characterized by diffuse Lewy body type dementia, which is a type of dementia seen in Parkinson's disease. For the first question, a 37-year-old mother of 2 children has bilateral headache that worsens with emotional stress. Pain is less severe in the early part of the day, but becomes more severe in the evening. There is tenderness over skull vault. So both children are not doing well in the school. What is the likely diagnosis? So this is tension type headache because you can see the stress here. Which of the following are causes of polyneuropathy? HIV alcohol phenytoin causes polyneuropathy. Rifampicin doesn't cause. Whereas isoniazid causes polyneuropathy. Which of the following statement regarding intracerebral hemorrhage is correct? So it accounts for 35%. No, it's less than 35%. Most common site is cerebral cortex. No. Use of cocaine and methamphetamines frequent cause in young. Yes, true. Hypertensive ICH from spontaneous rupture of small penetrating arteries. Yes. So that is called as lacunar infarcts. So a 21-year-old young lady presents to the OPD with unilateral facial weakness. She is unable to close her eyes on the affected side and there is vesicle in her ears. So this is typical of Ramsay-Hunt syndrome, varicella zoster. So affected nerve is 7th cranial nerve, facial nerve. Lesions of the dominant parietal lobe causes which of the following? Dysphagia, acalculia, dyslexia is true. Contralateral neglect is not seen. So this is usually seen in non-dominant parietal lobe. Which of the following are clinical features of neurofibromatosis 1? So in 1, angiomas, axillary freckles, and neurofibromas are seen, whereas you would have known the cutaneous schwannomas and also vestibular acoustic schwannomas, which are usually commonly seen in NF2. So which of the following are clinical features of Parkinson's disease? Bradykinesia, rigidity, and mask-like face are true. Spastic gait is not seen. So which of the following statements is correct for an individual with blood group AB? So the answer will be no antibody in plasma, because if there is anti-B, then the the blood B part of the AB blood group will be killed. So if there's anti-A, the A part of blood group will be killed. So for this patients, we do not need any antibodies in plasma. So AB antigens on RBC and no antibodies in plasma. Which of the following is unlikely to be associated with eosinophilia? So eosinophilia is usually associated with parasite worms and those kind of infection that is usually seen in Loeffler's toxo and Trichinella, not seen in TB. So the following is a tumor marker for carcinoma of pancreas, this CA99. How I remember is that if you see that 9, if you turn it slightly, it becomes like a shape of pancreas. So that is how I remember CA99. These are the following statements regarding G6PD enzyme deficiency are correct. So it is an X-linked, yes, true. Geographical distribution parallels to the malaria belt, no. Consumption of fava beans is protective, no. Transfusion support may be life-saving, yes, true. So 1 and 4 are true. So geographical belt, usually if you see in G6PD patients, those patients are resistant to malarial infections. So usually in malarial belt, this is not seen. Which of the following investigations indicate active hemolysis? Increase reticulocyte count, yes. Increase conjugated, no. So usually in hemolysis, there is unconjugated bilirubin. There is increased urinary urobilinogen and decreased haptoglobin. Yes, so answer is 1, 3, and 4. What type of anemia can be seen in DAPSOM, hemolytic anemia? So the following are decreased during pregnancy. Iron, vitamin B12, folate are decreased. Coagulation factors are increased because as we all know, pregnancy is a prothrombotic state. So the following drugs causes direct 10A inhibition. So if you see here, XA they have given here. So the answer in apixaban we have XA. So usually 10A inhibitors have XA in the name. So apixaban. 20-year-old girl presents with heavy menstrual bleeding, petechiae on her arms, and blood blisters in mouth. Her complete blood count shows hemoglobin 7, total leukocyte 8,700, and low platelets. Peripheral smear large shows large size platelets. So which is the likely best initial drug treatment for this patient? So this question is quite tricky because all these can be used for the treatment of this patient. This patient is probably suffering from immune thrombocytopenic purpura, and all these drugs are used in this patient. But what have they asked is which is the best initial drug? So initial drug is high dose corticosteroid. Then we'll give IVIG, still not control rituximab, and then other treatments. So the 30-year-old female presents with Malay breathlessness, often on paresthesias. She is vegetarian by diet. So this is the catchphrase here. So her investigation shows low hemoglobin, platelet, macrocytosis, and neutrophil hypersegmentation. Likely diagnosis megaloblastic anemia or vitamin B12 deficiency. Which of the following most common dermatological manifestation of diabetes mellitus is xerosis? Which of the following condition may result in hypoglycemia? So critical illness. Cortisol, usually steroid hormones tend to increase the sugar levels. Which of the following drugs may result in osteoporosis? Phenytoin, yes. Methotrexate, azathioprine, yes. Lithium doesn't increase. So 1, 3, 4. Which of the following oral anti-diabetic drug acts on renal proximal tubule? This is the new generation famous drugs. So these are this canagliflozin, dapagliflozin, SGLT2 inhibitors. These are the following was short-acting insulin, aspart, lispro, and regular. Glargine is long-acting. Hirsutism is seen in polycystic ovarian syndrome, yes. Congenital adrenal hyperplasia, yes. Hypothyroidism, no. Ovarian tumors, yes. In some of the ovarian tumors, you have seen the androgen secreting ovarian tumors. Those ovarian tumors tend to cause hirsutism, but hypothyroidism doesn't cause. Here the following are correct regarding hypothyroidism. More common in females, yes. Autoimmunity is a rare, etiopathogenesis, no. Mostly these diseases are due to autoimmunity. So that is why even in testing we do antibody testing, anti-TB antibodies. So in pregnancy, increased doses needed, yes. Suppressed TSH for osteoporosis, yes. So the answer is 1, 3, and 4. Which of the following are correct regarding diabetes insipidus? Polyuria, polydipsia are common. True, urine is of low osmolality and specific gravity, yes, because in urine there is lots and lots of water which is diluting the sodium and other minerals. So the osmolality in the urine is really low. Lithium is useful in treatment. No, lithium causes diabetes insipidus. So a potentially lethal hypothalamic thyroid damage is true. So the answer here is 1, 2, and 4. A 42-year-old lady presents with symptom of tiredness, constipation, impaired hearing, weight gain in spite of poor appetite. Which of the following relevant investigations to be done? This is thyroid problem. So that is probably hypothyroidism, and the testing to be done is TSH, free T4, anti-TB antibodies, and radionuclide scan is not needed. So answer is 1, 2, 3. A patient presents with circulatory shock, nausea, vomiting, diarrhea. Diagnosis of acute adrenal crisis is considered. A blood sample is stored for measurement of serum cortisol and treatment started without delay. So the following are appropriate intervention. We'll give IV normal saline because the patient is dehydrated. You can see here there is nausea, vomiting, diarrhea, all those things. Hydrocort because in adrenal shock the steroidal hormones are not working. So what we'll do is we'll have to supply the exogenous steroids. So as I already said, steroids when there is stress they increase the sugar levels. So if there is adrenal crisis, the sugar levels would be low. So we will give IV 10% glucose also. But the potassium level is already high, so KCl infusion is not needed. Answer is 1, 2, and 3. The most common acid-base disturbance in critically ill patient is chronic respiratory alkalosis. These are the following are the potentially reversible cause of weight gain: insulinoma, Cushing, sulfonylurea, beta blockers. Answer is all 1, 2, 3, 4. These are the following are the metabolic complications of parenteral nutrition. So hyperglycemia can be caused, liver cirrhosis can be caused, and because usually in TPN we'll check the LFTs. So the LFTs derange, we tend to taper or change the TPN. So liver cirrhosis can be caused, fluid overload, yes, can be caused. So answer would be 1, 2, 3. But in some books, what I've read is hyper and hypophosphatemia can also be caused. But we'll go with 1, 2, 3. Pseudomembranous colitis is associated with the following microbes: Clostridium difficile, characteristic rash on the face caused by parvovirus B19 is slap cheek rash. Bartonella infection is an important cause of blood culture negative endocarditis. True. Clinical diseases caused by Bartonella include cat scratch, yes. Trench fever, yes. Carrion's disease, yes. Anaphylaxis, no. So answer is 1, 2, 3. The causative organism and the vector for scrub typhus is Orientia Shutsugamishi, and trombiculate mite. So the following are correct regarding tetanus. Rhizus sardonicus, seen, yes. Endotoxin produced by affinity of sensory nerve endings, no. Yes. Exotoxin, lockjaw is painless, yes. Hysteria can mimic tetanus. So answer is 1, 3, and 4. A 25-year-old traveler from United Kingdom desires anti-malarial prophylaxis before traveling to India. There's history of seizures and depression, which of the following drug can be used. So 1, doxycycline can be used, atovaquone and proguanil can be used. Chloroquine should be used cautiously because that also has the potential of triggering seizures, but mefloquine is to be avoided. So answer will be 1, 2, 3. And if you get a choice to avoid chloroquine also, can avoid. So the pulmonary stage is seen which are the following: ascariasis, yes; strongyloids, onchocerca, yes. Consider the following statements with amphotericin B: narrow spectrum antifungal, no. There is the broadest spectrum. First, nephrotoxicity, yes, very badly. It lacks an oral preparation, yes. Lipid formulation are less toxic, yes. Liposomal amphotericin B is less toxic. So answer is 2, 3, 4. So the following molds can cause mucormycosis, commonly called as black fungus, that is rhizopus. So the following infections are caused by mosquito bite: malaria, yes; typhus, no; filariasis, yes; dengue fever, yes. So 1, 3, and 4. So the following is a hallmark of marasmus: tricep skin fold less than 3. So in kwashiorkor, what we see is edema or low protein. Anti-ribonucleoprotein antibody, anti-RNP, is characteristic of mixed connective tissue disorder. Polyarthritis nodosa has peak incidence. They are asking about the peak. It is 40 to 50. First line drug treatment to reduce fracture in osteoporosis, bisphosphonates. Which of the following are tricyclic antidepressants? So amitriptyline, yes; dosulapine, yes; paroxetine, duloxetine, and all those things are not TCS. They are SSRIs. So imipramine, yes. So answer is 1, 2, 4. Recurrent bouts of binge eating or issue with bulimia nervosa. During physical examination, 55-year-old male has low back pain. Quadriceps knee reflex was absent. So the following nerve roots most likely affected: L4. So the following conditions are parts of inherited cancer syndrome: retinoblastoma, yes; leaf romani, yes; xeroderma, yes; Peutz-Jeghers, yes. 1, 2, 3, 4. Which of the following are diseases associated with DNA repeat sequences: Huntington, yes; myotonic, yes; Friedreich ataxia, yes; Klinefelter, no. So answer is 1, 2, 3. Cardiac outflow tract, thymic hypoplasia, cleft palate, hypocalcemia are all pointing out towards DiGeorge syndrome. Early hypotension in venomous snake bite is due to which of the following: pooling of blood in pulmonary and splanchnic circulation, yes; systemic bleeding, yes; hemolysis, yes; loss of intravascular blood into soft tissue, yes. So all these four are mechanism of causing hypotension in venomous snake bite, but the earliest feature is pooling of blood in pulmonary and splanchnic circulation. Gastric aspiration and lavage is contraindicated in which of the following: strong acids, alkalis, petroleum distills are contraindicated, but it is to be given in ethanol poisoning. Acetylcysteine is an antidote for which of the following poisoning? Paracetamol. Which of the following is not a constituent of treatment of severe hyperkalemia? Calcium gluconate can be given. We'll also give ascaline salbutamol nebulization, which is a beta 2 adrenergic agonist, but here they have asked for beta 2 adrenergic receptor antagonist, so this is the wrong answer. Dialysis can be done. Sodium bicarb can be given. So Casanova forest disease is endemic to Southwest India. Which one of the following is not a usual cause of type 2 respiratory failure? In this is pulmonary embolism. This is a type 1 respiratory failure. So the first question is: a 10-year-old girl is diagnosed with dengue. She has abdominal pain, persistent vomiting. Examination reveals normal blood pressure, but the hematocrit is found to be increased. So what is the most appropriate initial fluid management? So this patient, in this history, what they have given is that the patient is having dengue with warning signs. So that is abdominal pain, persistent vomiting, and all those things. And when a patient comes with these signs, you will have to admit this patient. So after admitting, initially if the hematocrit is increased, we will have to start ringer lactates at 7 ml per kg per hour. So what we'll do is we'll just start with 7 ml per kg per hour. Then later on we'll recheck the hematocrit. If the hematocrit has decreased, then what we'll have to do is we'll have to change the RL fluids to 5 ml per hour for the next 1 hour, and then we'll change it to 3 ml per kg per hour for the next 24 to 48 hours. So that is how dengue with warning signs are treated. So the next question: a child presents with headache, vomiting in the emergency room following a fall from bed. Which one of the following treatment modalities is not recommended in the emergency room? IV mannitol, yes, this will decrease the ICP. And administration of hypertonic saline, yes. Elevate the head end by 30 degrees, yes. Again, this is to decrease the ICP. And therapeutic lumbar puncture, no. So if you are doing a lumbar puncture in a patient with high ICP, what will happen is that it can cause brain herniation. So whenever doing a lumbar puncture, first you will have to rule out high intracranial pressure. If there is high intracranial pressure, please don't do lumbar puncture. That will cause brain herniation. So the recommended ratio for chest compression to breaths administered by a single rescuer during resuscitation of a child in cardiac arrest. So remember, this can be a little bit confusing. If there is one rescuer, it is 30:2. If there is two rescuer, it is just 15:2. This is because when there are two rescuers, if you are giving it 15:2, the 15 compressions that they give will be very, very efficient. But if you see in the person with a single rescuer, just because they don't want to stop the CPR in between, they will continuously do it for 30 and then they will give 2 breaths. But if you see the 30 compressions, the first 15 or to 20 will be good, but the last 10 is not very good. So that is why when there are two rescuers, you will do it 15:2 ratio. Okay. So in adults, it is 30:2. The 4-year-old comatose child is assessed with modified GCS. So one of the following correct interpretations of the score given as E2, V3, M2 for the best eye, verbal and motor response. So E2 here it is eye opening to pain. So eye opening to speech will be usually 3. So E2 is eye opening to pain. V3 is verbal. Verbal 3 is cries to pain. So V3 is cries to pain. Moans to pain is V2. And then they have asked for what is M2, motor. So M2 is extension to pain. Whereas M3 is abnormal flexion to pain. So if it is E2, V3, M2, the answer is eye opening to pain, cries to pain, and extension to pain. If it was E2, V2, M3, then option C would be correct. Eye opening to pain, moans to pain, and abnormal flexion. But for this question, E2, V3, M2, answer D is correct. So what will a baby with mild hypothermia feel like when touched by the back of hand of an examiner? Mild hypothermia is less than 95 degrees Fahrenheit. So in mild, the abdomen will be warm, but the hands and feet will be cold. This is when the temperature is less than 95 degrees Fahrenheit. So which of the following manifestation is seen in hypocalcemia? So usually it's nausea and vomiting. So this is quite a controversial question. So a 6-week-old infant presents with unconjugated hyperbilirubinemia. Which of the following could be a likely diagnosis? So unconjugated hyperbilirubinemia is usually seen in Dublin-Johnson syndrome and Rotar syndrome. Dublin-Johnson, we know that it is due to the gene defect, and Rotar syndrome is also gene defect. So galactosemia, it also usually causes conjugated bilirubin, just like Dublin's and Rotars, whereas congenital hypothyroidism, that also causes conjugated hyperbilirubinemia. So that is the controversy here. Here they have asked about unconjugated hyperbilirubinemia, but all the 4 things cause conjugated hyperbilirubinemia. But on reading, there were some places where they have mentioned that some types of galactosemia can cause unconjugated hyperbilirubinemia. So if given these 4 options, I would like to go with galactosemia. But this is still a controversial question. A mother with polyhydramnios gives birth to a term newborn infant who develops choking and cyanosis on feeding soon after birth. There is excessive drooling and frothing from mouth, most likely diagnosis. So they have given the mother is polyhydramnios, which means that there is increased amniotic fluid. So this newborn also choking and cyanosis, having cyanosis on feeding. So this is usually seen in tracheoesophageal fistula, because when the child is eating, the food it goes from esophagus to the trachea. That's why the patient develops choking and cyanosis. So there is also excessive drooling and frothing from the mouth due to the same reason. So the answer here is tracheoesophageal fistula. So usually in newborns, what they do is that they tend to urinate, and in the fetus time they tend to urinate, and the fluid again goes into their mouth. So these children, the esophagus, since it is blind ending, they can have the fluid circulation is not very good inside and outside the fetus. So the amniotic fluid increases inside the uterine cavity, causing polyhydramnios. An infant just started to watch his mother intently when she talks to him. He has not yet started smiling black. What is the approximate age of the child? So this question says that started to watch his mother intently, which is done at 4 weeks. We has not started smiling back. That is usually seen at 6 weeks. So the, here the child's approximate age would be 4 weeks because they started to watch his mother intently and he is not smiling back. Had they asked if the child is smiling back at their mother, then it would be 6 weeks. A child demonstrates a mature pincer grasp, is able to build a tower of maximum 6 blocks and can make vertical and circular stroke with pencil. His developmental age is around what? So the question here, they have asked child is doing mature pincer grasp, which is usually seen at 1 year of age. But they have also given that child is able to build a tower of maximum 6 blocks and can make a vertical and circular stroke with pencil, which is usually done at 24 months. So the greater, so when you compare 1 year and 2 year things, the patient will have to choose the 2 year thing, that is 24 months. A typically developing girl is able to creep upstairs, build a tower of 2 blocks. Which of the following skills should she also display? So when the girl is able to build a tower of 2 blocks, that means the girl's age is 15 months. At 15 months, they are also expected to do scribbling. A child can ride a tricycle, hop on one foot, but cannot skip. Uses alternate feet while going downstairs. So it's not upstairs, it's downstairs. Which one of the following motor skills should he be able to perform at his developmental age? So when you see a child can ride a tricycle at 3 years of age, hop on one foot at 4 years of age, and can also use alternate field while going downstairs at 4 years of age. So at 4 years of age, we'll expect the child to copy a cross, that is 4. So usually triangle, that is at 5 years of age, and cross is 4 years of age, and can also draw square at 4.5 years age, and circle at 3 years of age. So the next question is, which one of the following skills is a normally developing 2-year-old infant unable to perform? So what 2-year-old cannot perform is that cannot copy a circle. As I just said, circle is being copied only at 3 years of age. At 2 years of age, copying a circle is not expected. Which of the following statement is age appropriate for a normally developing 4-month-old infant? So the infant can bring his hand to the midline. Yes, this is usually expected. The infant has still not attained partial head control. So yeah, partial head control is usually attained at 6 months of age. The infant has started making monosyllable sounds like da, pa, again at 6 months of age. So which one of the following statement is age appropriate for a normally developing 4 months old infant is child can bring his hand to the midline, whereas infant has started to reach out one hand, partial head control, da, pa, are usually seen at 6 months of age. Which one of the following is used to estimate the surface area of burn injuries in children less than 15 years of age? So here the answer is London Broder chart. Rules of 9 is used for adults, and Parkland formula is usually for calculating fluids, and this is not for measuring body surface area. Answer is C. A 4-year-old boy presents with ingestion of many tablets of salicylate. Which one of the following complications is likely to develop? Salicylate is nothing but salicylic acid. So whenever you ingest acid, what you will get is metabolic acidosis. A 3-year-old boy presents with parental concerns regarding delayed development, especially speech. On observation, clinician notes decreased eye contact, inattentiveness, unresponsive being called, and toe walking. What is the most likely diagnosis? So here they have given 3 years old, where autism spectrum is usually seen around 3 years of age. ADHD can be seen till 12 years of age. So also other two C and D options are not likely. So we'll have to choose between A and B. So in autism spectrum, the patient will have speech problems and also development problems. So social problems are also there. and patient is also inattentive. So this is most likely to be autism spectrum, because in attention deficit hyperactivity disorder, what happens is that the patients will usually have hyperactivity and inattentiveness again, and then they can have more and more symptoms, which usually is not given in this questions. So then the next question, atomoxetine is prescribed to children with autism spectrum disorder to control the symptoms of hyperactivity, because atomoxetine is usually just like a drug like clonidine. It's like an alpha 2 agonist, just usually used in autism spectrum disorders for mainly for the controlment of the hyperactivity. So fractional inactivated intradermal poliovirus vaccine is given at which age of national immunization schedule? So we have to be here. We have to be careful here, because they have asked for the fractional inactivated intradermal poliovirus. So usually IPV is given at 6, 10, and 14 weeks, but the fractional intradermal polio vaccine is given only at 6 and 14 weeks. For protective efficacy of varicella vaccine, which is used for post-exposure prophylaxis within 72 hours of contact, is 70%. So after contact, it is 70%, but before contact can go till 80 and 90%. A 10-year-old child presents with difficulty in word recognition, word decoding abilities, difficulty in speech, and normal listening comprehension. So the patient here, what they are asking is the diagnosis, which is usually dyslexia, because you can see here the patient is having normal listening comprehension, and they haven't given much of clues to choose the answer as B, C, and D. So here they are mainly talking about the words, so it is dyslexia. Which one of the following is the best strategy to use in management of temper tantrums in a 3-year-old boy? So here giving it to the demands physical punishment, scolding, no. Timeout is the answer. So timeout is means not giving attention to the child. So how it is done is corresponding to the years of age. So if it is a 1-year-old boy, we'll give timeout of 1 minute. 2-year-old boy, timeout of 2 minutes. So here it is a 3-year-old boy, so we'll give timeout of 3 minutes. So that was the pediatric questions. So the first question was, what are the following? Which of the following are types of wound healing? So primary intention, secondary intention, tertiary intention, quaternary intention. We all know that primary intention is putting the suture. So secondary intention is not closing the wound, just leaving it to heal by itself. And tertiary intention is delayed primary intention. So there's nothing called as quaternary intention. So the types of wound healing, the answer is 1, 2, and 3. A 50-year-old female presents to the emergency with pain, swelling, and redness over the left foot following a trivial trauma 3 days back. On examination, the swelling over the left foot is poorly localized. Local tenderness and erythema are present. Crepitus is absent. Distal pulsations are palpable. Most likely clinical diagnosis is. So here we can rule out fasciitis because there is no crepitus, and abscess because the swelling is not localized properly. And the thing is that we have to choose between compartment syndrome and cellulitis. So on referring the books, so usually in compartment syndrome they haven't mentioned anything about the redness. So and the erythema. So in cellulitis usually all these things are seen: the pain, swelling, redness, and swelling being poorly localized, local tenderness, erythema. So there is a mild thing with mild controversy between compartment syndrome and cellulitis. But what I have referred, the answer looks like cellulitis. So the next question: which one of the following is not associated with BRCA1 and BRCA2 genes? We all know that breast cancer is associated with BRCA1, and we have learned a lot about it. And ovarian cancer, prostate cancer is also associated with BRCA, and liver cancer is not associated with BRCA. So the other cancers which are also associated with BRCA is like colorectal cancers. We also have pancreatic cancers, but not liver cancer. The malignancy associated with Stewart-Trevis syndrome. So this one, you would have seen the picture. This is like a blue color thing or purple color purple color in the hand above the swelling. So this is usually occurring on the long-standing lymphedema, that is lymphangiosarcoma. So long-standing lymphedema, what happens is that after like 10 years or 12 years, this edema gets converted into a angiosarcoma. That is called as lymphangiosarcoma or Stewart-Trevis syndrome. A 60-year-old lady underwent total abdominal hysterectomy. On the third post-op day, she suddenly felt breathless while returning from washroom. Her BP is 80/50, most probable diagnosis. So postural hypotension not possible because she was so not suddenly getting up from bed or something, and TIA is also not very unlikely. So the diagnosis for this probably lies between the options B and C. Can be secondary hemorrhage or thromboembolism. Given the fact that she is feeling breathlessness, that is suddenly she is feeling breathless. So this is a symptom of pulmonary embolism, and her BP is also 80/50. So in pulmonary embolism, we can also have low BP because due to block, there is no cardiac return of blood, so the cardiac output is less, and there can be shock also. The other thing is that it could also be secondary hemorrhage, but secondary hemorrhage, they would have it's like the breathlessness, the sudden onset of breathlessness, it's unlikely. But a BP of 80/50 is definitely pointing out to secondary hemorrhage. But the answer here, given that there is on third post-op day, sudden breathlessness and BP 80/50, I would go with thromboembolism. A 52-year-old female underwent MRM. After a few years, she developed lymphedema on the ipsilateral arm. Which one of the following malignancies can develop? We have just discussed it. This is lymphangiosarcoma. That is Stewart-Trevis syndrome. So a gentleman of 60 years old presented with a brawny swelling of the submandibular region with inflammatory edema of the mouth and putrid halitosis. Most likely diagnosis. So brawny swelling is something like a thick swelling with in the submandibular region with inflammatory edema and bad breath. So tubercular adenitis is usually seen in the cervical region, and these findings are usually not very commonly seen. So brawny swelling, the classical thing we can see is Ludwig's angina. So the Ludwig's angina also causes submandibular region swelling. It is all inflammatory edema of mouth and very bad breath. So the answer to this mostly is Ludwig's angina. A 25-year-old female patient with previous history of neck irradiation presents with thyroid swelling for the last 6 months. The patient is clinically euthyroid. On examination, right lobe of thyroid is enlarged with presence of ipsilateral cervical lymphadenopathy. Most probable clinical diagnosis. So previous history of neck radiation can always mark papillary carcinoma of the thyroid. An infant presents in the surgical OPD with complaints of unilateral swelling of the neck. The swelling was soft, cystic, partially compressible, and brilliantly transluminant. Most probable diagnosis. So among these, only cystic hygroma is brilliantly transluminant and compressible. So we'll go with cystic hygroma, and this is also seen in the infants, which is commonly pointing out towards cystic hygroma. Remember that cystic hygroma is also associated with Turner syndrome. Serum thyroglobulin level is an important tumor marker for papillary thyroid carcinoma. So for medullary thyroid carcinoma, it's calcitonin. So for papillary thyroid carcinoma, it's thyroglobulin. A 43-year-old woman presented with serious discharge from a single duct of nipple in her right breast, which was sent for evaluation. She's likely suffering from. So if the discharge is from single duct, it's intraductal papilloma, for which we do the operation microductectomy. But if it is from multiple ducts, that is commonly duct ectasia. So for duct ectasia, the common operation done is Hatfield's operation. So here the answer is intraductal papilloma. An 8-month-old male child is brought to the emergency with recurrent episodes of screaming and drawing up of legs. The child appears to be listless in between the attacks. Local examination of the abdomen reveals feeling of emptiness in right iliac fossa. So this is an important point. So there is also blood stained mucus is found in the finger on per rectal examination. The probable diagnosis is, so if you see here, local examination of abdomen, there is emptiness in right iliac fossa. This is called as the sign of dance. And also blood stained mucus, that is red currant jellies stools. So these two point out to the diagnosis of acute intussusception. So which one of the following statement regarding Ogleve syndrome is correct? Ogleve syndrome is colonic pseudo-obstruction. So it is presents as acute large bowel mechanical obstruction. No, the name itself says it's pseudo-obstruction. So it is not mechanical obstruction. So this is the wrong answer. The other things, marked cecal dilation, common feature on X-ray, true. Cecal perforation is well recognized complication, true. IV neostigmine is used to treat this condition in order to get the bowel keep going. So the answer for this is 2, 3, and 4. Which one of the following statement regarding carcinoid tumors are correct? Terminal ileum is most common site for these tumors in GIT. These tumors arise from Kulczycki scales. So 5-hydroxytryptamine is the most common peptide. Serum chromogranin A is useful in marker of this disease. So this is a very controversial question, but for surgery, what the paper answers are referred to is from Bailey and Love. So what Bailey and Love says is that appendix is the most common site for these tumors. So in this question, the wrong option is terminal ileum is the most common site. So we'll go with 2, 3, and 4. In familial adenomatous polyposis, which of the following are true? Presence of more than 100 colorectal polyps, it's true. Positive family history, yes. Autosomal recessive, no. That is autosomal dominant condition. So genetic mutation is seen on chromosome 5, it's the APC gene. So in FAP syndrome, there is that is usually autosomal dominant syndrome. So answer is 1, 2, and 4. A 50-year-old male patient presents to the emergency with sudden onset of upper abdominal pain, nausea, vomiting, hematemesis. On examination, tachycardic and hypotensive. Pallor is present. CCT abdomen reveals a large exophatic tumor of the size of 13x8 at the fundus of the stomach. This is important. On upper GI endoscopy, mucosa of the tumor is intact. Staining of CD117. So staining of CD117 or the CMYC staining. So if this staining is positive in upper GI endoscopy and the tumor, if it is very large, the probable clinical diagnosis is gastrointestinal stromal tumors. Which one of the following is not a classical symptom of acute appendicitis? So anorexia is seen, periumbilical colic. Yeah, the pain usually starts in the periumbilical region and then migrates to the right iliac fossa. So that is why this migration of pain is also included in the mantrals or the modified alveolar order scoring. Nausea is also seen, but constipation usually not seen. Among the extraintestinal manifestations of Crohn's disease, which one of the following is related to the disease activity? So eye complication, iritis, uveitis is related to the disease activity. Renal calculi, PSC, chronic active hepatitis is not related. Other conditions related is pyoderma gangrenosum, and those kind of conditions is usually related to the disease severity. The modified model for end-stage liver disease MELD score includes, so if you think of MELD, remember CBI. CBI is creatinine, bilirubin, and INR. So serum albumin is not included. Which one of the following statement regarding enteric perforation are correct? Salmonella typhi is the causative organism for enteric fever, true. Enteric perforation characteristically occurs during 3rd week of illness. Yes. Typhoid ulcers are placed transversely in the long axis. No. Typhoid ulcers are longitudinal. Remember tie. So when you are wearing a shirt, you wear a tie. So that tie is lying longitudinally. So whenever you remember about typhoid, think about longitudinal ulcers. And then the terminal ileum is the most common site for enteric perforation. True. The only wrong answer is option 3. So correct answer is 1, 2, and 4. A 35-year-old male patient with enteric fever presents to the emergency with sudden onset of generalized abdominal pain, abdominal distension, nausea, vomiting, constipation for the last 48 hours. On examination, she is tachycardic, hypotensive, generalized tenderness, rebound tenderness, board-like rigidity. Board-like rigidity is usually due to peritonitis. So peritonitis commonly occurs due to small bowel perforation in the typhoid fever. So typhoid fever, if you remember the ulcer, just now I said the ulcers are longitudinal. Whenever the ulcers are longitudinal, there is an increase in chance of perforation. So these ulcers commonly cause perforation. So small bowel perforation is the answer for this question. So which one of the following options are used for management of pancreatic pseudocyst? For the pseudocyst management, we either do cystogastrostomy, we connect the cyst to the stomach and let it drain, or we can do percutaneous drainage with the help of pigtail catheter. Endoscopic drainage can also be done, but pancreaticoduodectomy, such a morbid surgery is not required. Which one of the following statements regarding hepatic adenomas are correct? These are commonly almost exclusively seen in females 25 to 50 years, yes. Associated with OCPs, yes. They do not have any malignant potential, no. They actually have malignant potential. So majority are detected incidentally on imaging, yes, true. The answer is 1, 2, and 4. Which of the following are probable sites for ectopic pancreas? Submucosa of the stomach and duodenum, yes. Liver, yes. Splenic hylemus. Small bowel mesentery is wrong here. So I've referred this in the Bailey textbook. They have given it clearly that liver is also included. Submucosa of stomach is included. Splenic hilum is also included. So which of the following statements regarding Cantley's line is correct? So runs between Cantley's line, we all know that runs between the IVC and the gallbladder fossa. But what they have done in this question is that they have just slightly twisted it. Instead of IVC, the correct answer here is it runs between gallbladder fossa and the middle hepatic vein. So middle hepatic vein corresponds to the IVC. Which of the following are indications of splenectomy? So pseudomyxoma peritoni, no. Trauma, yes. ITP, yes. Hypersplenism, yes. A 45-year-old male presents with painless firm abdominal swelling, 10-8 near the umbilicus. Swelling can be moved freely in a plane at the right angle of the line, attachment of the mesentery. So if you see here, this is the Tillock's triad that they have tried to mention here. Tillock's triad is usually seen in mesenteric cyst. There is what this triad says is that there's a swelling near the umbilicus which can be moved freely, and when you auscultate it, you can hear the tympanic note. The answer is mesenteric cyst. A 45-year-old male patient, a known case of left inguinal hernia, presents to the emergency with an acute onset. So acute onset of pain abdomen with nausea, vomiting, distension. His pulse rate, tachycardic, hypotensive, respiratory rate is 24. Local examination, skin over the swelling is tense, erythematous. Localized tenderness over the swelling. The swelling is irreducible with the absence of cough impulse. Most probable clinical diagnosis here in this patient is strangulated hernia. If you see here, what you can also use a small trick here. The obstructed hernia is also called as incarcerated hernia. So they won't give both. If these things mean the same, they won't give it as a different option. So you can choose the strangulated hernia. Plus, we can also see here that the blood supply has been cut off. So that is why the patient is having this hypotensive and all those signs. So that is probably pointing out to strangulated hernia. Mayos repair is done for incisional hernia. Mayos repair is usually done for less than 2 to 3 centimeter hernia, and it also has high recurrence rate. In Pringle's maneuver, clamping includes CBD, hepatic artery portal vein, and IVC. Generally, we do not clamp IVC because that has severe consequences. So CBD, hepatic artery, and portal vein are compressed or clamped in the Pringle's maneuver. A patient with suspected head injury is brought to the emergency following RTA. At the time of examination, his GCS is 14 and stable vitals, bleeding from right ear and CSF leak from nose. Bruising is present behind the right ear. So this is pointing out a battle sign. So battle sign is usually seen in base of skull fracture. Commonest organism causing suppurative otitis media is Streptococcus pneumoniae. So a patient in RTA presents to emergency with increasing restlessness and difficulty in breathing. Respiratory rate is 26, distended neck veins, trachea deviated to the right side. Hyperresonant node and absence of breath sound on the left side. So we all know that it's a left-sided tension pneumothorax. So what do we do in tension pneumothorax is that we do immediate needle decompression. So whenever you suspect a tension pneumothorax, you don't have to do a chest X-ray, because while the time you do the chest X-ray, the patient might collapse actually. So instead of, if you have a clinical suspicion, you go for the needle decompression initially, and then chest tube should be inserted. So the answer here is 1, 2, and 4, and wrong option is 3. We do not do chest X-ray. PET scan is used in preoperative staging of gastroesophageal tumor to detect. PET scan in the gastroesophageal tumors is usually to detect the occult metastasis. That is, so here the option will be distant metastatic diseases. So which of the following are correct about ectopic ureters? So more common in males, no. They're more common in females. For in fact, that the ratio is 7:1. 7 females is to 1 male. So this answer is wrong. They drain in the upper pole of kidney, yes. Associated with duplex ureter, yes. They may cause incontinence, yes, definitely. Answer is 2, 3, and 4. So now the following agent is nephrotoxic anesthetic agent. Answer is methoxyfluorine. The fluorine compound in this methoxyfluorine is causing severe nephrotoxicity. So this is methoxyfluorine is a very bad agent for the kidneys. A comatose patient sustaining head injury is in the neurosurgical ICU. So the following parameters should ideally be maintained in this patient. So if you see a PaCO2 33 to 38 yes, mean arterial pressure 80 to 90 yes, PaO2 more than 11 yes, sodium less than 130 no. So usually we don't cause the sodium to be very low. So that too less than 130 is very bad. Less than 140 is preferred. Untidy wounds are characterized by each of the following: crushed or avulsed, yes; contaminated, yes; devitalized, yes; no loss of tissue, no. No loss of tissue, it's not an option. It's usually seen in the tidy wounds. So which of the following statements regarding composition of common crystalline solution is correct? So NS contains 100 milliequivalents of sodium, no. 154. Hartmann solution, that is Ringer lactates, contains 111 milliequivalents of chlorine. Yes, this is the correct answer. NS contains 130 mex of chlorine, no. Again 154 mex. RL contains 111 mex of sodium, no. Contains 130 milliequivalents of sodium. Perioperative benefit from transfusion with a hemoglobin level of less than 6 grams. If it is less than 6 grams, we can have some benefit. 6 to 8 grams may or may not, but more than 8 grams is not beneficial. So the answer is less than 6 grams. First question is, ideal weight gain during pregnancy for a woman with normal BMI should be 11 to 16 kgs. Blood volume increase during pregnancy above non-pregnant level at 30 to 34 weeks is by 40 to 50%. Remember, the hemoglobin increases by 20%, but the blood volume increases by 40 to 50%, so there is dilutional anemia. Which of the following are contraindications to external cephalic version in antenatal management of breech presentation? So antepartum hemorrhage is a contraindication. Multiple pregnancy is a contraindication. Reactive non-stress test is not a contraindication. Severe oligohydramnios is a contraindication. So answer is 1, 2, 4. Antepartum hemorrhage is defined as bleeding from genital tract after 28 weeks of pregnancy. Which of the following is not a risk factor for preeclampsia? So the answer is placenta previa. All the primigravida, obesities, pre-existing vascular disease are a risk factor for preeclampsia, but placenta previa is not a risk factor for preeclampsia. What are the Spiegelberg's criteria for diagnosis of ovarian pregnancy? Tube on the affected site must be intact, yes. Gestational sac must be in the same position of ovary, yes. Gestational sac is connected to uterus by ovarian ligament, yes. Ovarian tissue must be detected on the wall on histological examination. So the answer is 1, 2, 3, 4. Which one of the following statement regarding fetal well-being is not correct? So daily fetal movement count is a simple, reliable method for fetal well-being, yes. Modified biophysical profiles include non-stress test and fetal breathing. No. Modified BP score includes non-stress test and amniotic fluid index. Mothers perceive 88% of fetal movements true. Healthy fetus should have a minimum of 10 movements interval hours true. So the following statements are correct with respect to antenatal ultrasound. Helps in detecting gross fetal anomalies, yes. Helps in identifying multiple pregnancy, yes. Helps in identifying viable pregnancy, yes. Best dating is in third trimester scan, not in first trimester scan. So answer is 1, 2, 3. During pregnancy, iron supplementation is needed for all pregnant mother from 16 week onwards. The clinical feature of physiological edema in pregnancy is disappears or markedly reduced on rest, because this edema is due to compression of the IVC. So on standing, the pressure of compression is more than 100. So when patients rest, or the pregnant ladies rest, so the compression is pressure is sometimes relieved in the femorals, and then the edema can gradually reduce. So the normal rate of dilation of the cervix in primary gravida is in the active phase of labor. So they have been asking about the active phase of labor, that is after 4 centimeters of cervical dilation, so that is 1 centimeter per hour. In the mechanism of normal labor, the engaging transfer diameter is biparietal diameter 9.5 centimeters. Compared to breast milk, colostrum has higher protein content. In non-lactating mothers after delivery, ovulation may occur as early as 4 weeks. Okay. Which one of the following are the prerequisites for outlet forceps delivery? Bladder should be empty, yes. Membrane should be intact, no. Membrane should be ruptured. Cervix should be fully dilated, yes. Fetal skull has reached the level of pelvic floor, yes. So answer is 1, 3, and 4. The vaginal pH in childbearing age normally ranges from 4 to 5.5. The Gartner's duct cyst is usually located in anterolateral wall of vagina. Endometrial sampling for diagnosis of ovulation is done on which day of menstrual cycle? That is 21st to 23rd day. Primary dysmenorrhea can be treated by which of the following? Now this is a very tricky question. So in the Shah's textbook of gynecology, they have given all the 4 options to be correct. For primary dysmenorrhea, antiprostaglandins can be given, cyclic combined contraception can be given, presacral neurotomy can be done, uterine curettage also been done. So since they have given the option to select only 3, we'll select 1, 2, and 3. So fourth one is not usually very frequently done. So answer is 1, 2, and 3. Again, if you get clarity in this question, please do comment. Which one of the following is correct regarding obesity and infertility? It is associated with hypogonadotrophic hypogonadism. So one of the following is an abnormal parameter in accordance with WHO serum, not serum, it's semen analysis criteria. So answer is viscosity, which should be less than 2.5. Which of the following are causes of GnRS dependent precocious puberty? Constitutional, yes. TB, encephalitis, yes. McCune-Albright syndrome, yes. Primary hypothyroidism is usually GnRH independent precocious puberty. So answer is 1, 2, and 3. Which one of the following is the most important hematological condition to be ruled out while investigating a case of puberty menorrhagia? So we'll rule out coagulation disorders. A couple presented to OPD with complaints of inability to conceive for the last 3 years. Husband was advised semen analysis, which is the WHO criteria for minimal sperm count per ml in normal semen. So it is 15 million. So usually at least 1.5 ml of semen is to be considered to be normal. So each ml will have 15 million sperms. Which of the following are risk factors for developing pelvic inflammatory disease in female? Use of oral contraceptive pills. No, it is actually protective. Multiple sexual partners can cause PID. Low socioeconomic genetic predisposition can cause PID. So answer is 2, 3, and 4. A 65-year-old postmenopausal lady presents to gynecological OPD with abdominal distension, weight loss. On investigation, she was diagnosed an ovarian tumor. Most common type of ovarian tumor in this woman. So in this woman is 65 years old, and most common ovarian tumor seen in 65 years old is epithelial tumor. So the following are the characteristic features of Meigs syndrome in a female. Right-sided hyperthorax, yes. Ascites, yes. Genital warts, no. Fibroma ovary, yes. So answer is 1, 2, and 4. A 25-year-old girl is presented to gynecological OPD with complaints of abdominal pain, heavy menstrual bleeding with a mass arising from the hypogastrium corresponding to 16 weeks gravid uterus. Her urine pregnancy test is negative. Most likely diagnosis uterine fibroid, because if you can see here, there is heavy menstrual bleeding and there is also a mass, so which is equaling to a gravid uterus. So that most commonly should be a most common should be uterine fibroid. 39-year-old nulliparous female has presented to the gynecological OPD with complaints of postcoital bleeding for past 6 months. The first investigation to be offered to this female is Pap smear to rule out cervical cancer. Procedentia has a degree of uterovaginal prolapse characterized by descent of. This is the most serious type of prolapse. So that is uterine cervix, the body with fundus, outside vagina with eversion of entire vagina. So all uterus and vagina outside. So the following are the indications of vaginal examination during labor. To stretch the vaginal intermittently, no. At the onset of labor can be done. To monitor the progression of labor can be done. Following the rupture of membranes can be done. So the indications of vaginal examination during labor is 2, 3, and 4. So now the following statements regarding RH isoimmunization are correct. Lilly's chart identifies anemia better than middle cerebral artery Doppler. No, this is wrong. Indirect Coombs test positive in mother, yes. Babies at risk of developing anemia, definitely yes. Direct Coombs test positive in baby, yes. So answer is 2, 3, and 4. As per ICMR guidelines, which are the following are the criteria for SARS-CoV-2 exposure for a pregnant female during COVID-19 pandemic? Traveling to an affected country within 14 days, true. Close to contact with the confirmed case within a distance of 1 meter for more than 15 minutes, definitely yes. Living in the neighborhood of a confirmed case, not a criteria. Direct contact with body fluids, yes, it's a criteria. So answer is 1, 2, and 4. Which of the following are the clinical features of septic abortion? So there will be persistent tachycardia more than 90 beats per minute, impaired mental status, and hypothermia. So answer is 1, 2, and 3. Consider the following statements. In fetal growth restriction, there is always oligohydramnios. In fetal growth restriction, there is placental insufficiency leading to redistribution of blood flow to the heart, brain, fetal brain, shunting from a fetal kidney. So answer is both statement 1 and statement 2 are correct, and statement 2 is the correct explanation of statement 1. So the following are correct regarding failure of contraceptive methods. Depo-methoxyprogesterone DMPA 0 to 1 true, Norplant 0 to 1 true, levonorgestrel IUS 0 to 0.2 yes, levonorgestrel 3 per 100 mm yes, no wrong. The answer is 1. Correct answer is 1, 2, 3. Considering the following in the respect of ormeloxifene, so it is a research product of Central Drug Research Institute Lucknow, true. It is steroidal component, no, it's a non-steroidal component. It is a potent anti-estrogen and weak estrogenic properties, yes. It is a selective estrogen receptor modulator. It does not inhibit ovulation, yes. So the answer is 1, 3, and 4. Steroidal contraceptive available in the basket of contraceptive choice from Ministry of Health and Family Welfare, Government of India are monophasic. So the following are absolute contraindications for combined oral contraceptives. So arterial and venous thrombosis cannot be given. Severe hypertension, we can't give cirrhosis. Gestational trophoblastic neoplasms, yes, we can give combined oral contraceptives. Diabetes with vascular complication, again we can't give. So answer is 1, 2, and 4. After male sterilization, additional contraceptive protection is needed for 2 to 3 months. So the first question is the life expectancy of at birth for a country A is 64 years. The minimum and maximum values of life expectancy are 20 years and 86 years respectively. As part of Human Development Index, what is the life expectancy index for the country A? So the formula to be used here is life expectancy of the country minus 20 divided by 85 minus 20. So the life expectancy here is 64. So 64 minus 20 divided by 85 minus 20, which is 44 divided by 65. So the answer will be 0.667. Which of the following indicators stand consolidated in physical quality of life index? We in PQLI will see infant mortality rate, life expectancy at age 1, but per capita income is not seen, literacy rate is seen. So answer is 1, 2, and 4. Consider the following stuff. Which of them will be routinely posted in PHC? Yes, medical officer will be posted, pharmacist will be posted. There is no need of anesthetist in PHC. Health educator will be present. So 1, 2, and 4. So now the following management techniques helps in standardizing the methods of performing jobs. So the answer here is work sampling. So I couldn't find this answer in our textbooks. So after referring an MBA textbook, so I had concluded it to be work sampling. If there is any changes, please do let me know. STDs are transmitted by direct contact. So under the international health regulations, which of the following diseases are notifiable by the National Health Authority to the WHO? So cholera, yes. Plague, yes. Klebsiella pneumonia, no. Yellow fever, yes. So answer is 1, 2, and 4. So now the following study designs, the unit of study involves populations rather than individuals. So this is easy ecological studies. So the following table shows mortality figures among hazardous industry workers. What is the standardized mortality ratio of the hazardous industry workers given here as compared to the national population? So the formula to be used is observed deaths divided by anticipated deaths. So how many we observe divided by how many is expected times 100. So the number of deaths we have observed here is 8 plus 9 plus 13, which is equal to 30. So the deaths which are expected as compared to the national population, to know how to know that. So if you see here, the national population that is per 1000. So per 1000 there is two deaths expected, but if the population is 3000, the expected will be 2 times 3, so that is 6. So here 3.5 times 2, that is 7. So 6.0 times 2, that is 12. So 6 plus 7 plus 12, which is equal to 25. So observed deaths are 30, expected deaths is 25. So 30 divided by 25 into 100 is equal to 120. So that is the formula to be used here. Which one of the following best explains the relationship among prevalence, incidence, duration of a disease given the assumption that the population is stable? So use this formula. So prevalence is incidence time duration. A new test was developed for the detection of COVID-19. What is the sensitivity of the test as per the information provided above? So sensitivity, the formula we know that is true positive divided by true positive plus false negative. So true positive here is positive, test is positive and disease is positive, 60. So divided by true positive plus false negative. So 60 divided by 60 plus false negative. That is, the disease is present but the test came out negative, that is 100. So true positive divided by true positive plus false negative is equal to 60 divided by 60 plus 100 times 100. So 60 divided by 160 times 100, which is equal to 37.5%. The blood glucose level of 5 individuals given 110, 94, 102, 98, 96. Consider the following statement. Range is 16, median is 98, standard deviation is root of 10. So which of the following statements are correct? So first they have given these 5 numbers. What you do in your rough paper is that you will have to arrange these numbers according to ascending order. So it will be 94, 96, 98, 102, and 110. So the mean value will be add all the 5 divided by the number of samples. So if you add all the 5 values, it will be 500 divided by 5 samples. So 500 divided by 5, that is 100. Median will be the middle number. So middle number after arranging in ascending order is 98. So range will be highest number minus lowest number. So 110 minus 94, which is 16. So range is 16, median is 98, correct. But the important thing here is standard deviation they have given it as root of 10. So to calculate this, it is a tedious process. So how to calculate the standard deviation is that we will have the sum of x minus x to the power whole square divided by n minus 1. So that is sum of number. What is the number? Each number minus mean value. So each number minus mean value to the root of whole square should be done. So if you see each number, first number was 94 minus mean value was 100. So 94 minus 100, 6 to the root of whole square. Then plus the next number, 96 minus 100. So this is 4 to the root of whole square. So you will have to do this for the all 5 numbers. Then you divide it by number of samples minus 1. So 5 minus 1 is 4. So after doing this calculation, what you will get is 160 divided by 4. So the standard deviation comes to the root of 40, not root of 10. So the answer here is 1 and 2. Which one of the following are true about measles? It is highly infectious in the face, following appearance of rash, true. Infection usually confers lifelong immunity, true. Low secondary attack rate, no, it's a high secondary attack rate. So answer is 1 and 2. So now the following drugs should be avoided in the first line ART regimes because of its well-known recognized metabolic toxicities, stavudine. The recommended dose for cotrimoxazole for treatment of pneumonia in a child weighing 16 kg is, so cotrimoxazole usually has trimethoprim and sulfamethoxazole, trimethoprim 80 milligrams, sulfamethoxazole 400 milligrams. So in pediatric age of less than 20, that is a range of 15 to 20, what we usually give is one pediatric tablet twice a day. Hepatitis B vaccine administered at birth is a monovalent vaccine of hepatitis B, but later when it is administered, it is given as a pentavalent vaccine, including DPT, hepatitis B, and human influenza virus. So at birth, it is given as monovalent vaccine. The classical triad of congenital defects in congenital rubella syndrome includes which of the following? Deafness, cardiac malformations, and cataract. Cardiac malformations, mostly PDA. So answer here is 2, 3, and 4. Which of the following are correct in respect of diphtheria? Incubation period is 14 to 28 days. No, it's 2 to 5 days. Diphtheria antitoxin treatment is used in treatment, true. Which one of the disease protected from pentavalent vaccine, true. So answer is 2 and 3. The person has presented with a history of dog bite on the uncovered surface of his right leg. There is minor abrasion without bleeding. So this is a class 1, category 1 bite. So this should be taken as category 1 bite, and it just requires local treatment of the wound. So answer is 1 and 2. Consider the following steps of modern sewage treatment plants, which is first what happens is that the sewage will be screened, then grid chamber, it will go under the grid chamber, then it goes to the primary sedimentation tank, then sludge digester is taking place. So answer is 3, 1, 2, 4. A vital layer known as Schmutzdesky is which of the following? Seen in which of the following is slow sand filter. A 25-year-old woman is a sedentary worker. She is lactating mother with a 3-month-old child. Which among the following is the best approximation of her energy requirements in terms of kilocalories per day? So in a sedentary worker, sedentary female, it is 1900 kilocalories needed. But since this patient is lactating, you would have to add plus 600. So it's 2500 kilocalories per day. The amount of iron lost per 28-day cycle of menstruating woman is 12.5. Most sensitive indicator of environmental iron deficiency is prevalence of neonatal hypothyroidism. Insulin resistance syndrome, syndrome X, is associated with type 2 diabetes, hyperinsulinemia, dyslipidemia, no hypercalcemia. So answer is 1, 2, and 3. The DASH diet is a lifestyle modification management of hypertension. That is reducing more of red meat and eating more of vegetables. Which one of the following is a famous large prospective study that helped establish risk factors for coronary heart disease? Framingham study. Most industrial workers are exposed to lead as an occupational hazard. So the following statements are correct. Lead poisoning is plumbism, true. Vasoflic stippling of RBC seen, true. Progressive massive fibrosis of lungs is seen, no. Coproporphyrin in urine is useful screening. So answer is 1, 2, and 4. Of the following international agencies, which agency has been assisting India in development of friendly modes of sanitization? Swedish International Development Agency. So now the following was used for measuring economic status of households in the National Family Health Survey 3. That is Kupuswamy scale. I have a doubt about this question. Please refer. The NFHS3 is mainly used for the screening of HIV. So please check if the answer is correct. Kupuswamy scale. In a town with 1 lakh population, there are a total of 2,500 live births in a year. There were 75 total deaths in children before the age of 1 month, total 200 deaths before the age of 1 year, and 300 before the age of 3 years. So the following statement regarding infant mortality rate of the town, the given are correct. So infant mortality rate is usually calculated by death in less than 1 year children, that is infants, divided by total live birth in that year. So death less than 1 year is 200, divided by total live birth is 2500. So it comes to around 80. So infant mortality rate of this town is 80 per 1000 live births, true. Denominator is 1 lakh, no. Denominator is 2500 number of live birth. Infant mortality rate town higher than the current national average of infant mortality rate in India, yes, true. Currently it's around nearly 30. So this town is having 80. So it's higher. The numerator is number of children dying before the age of 1 month. No, it's 1 year. So answer is 2 and 4. The voluntary scheme under which any obstetrics and gynecology specialist, lady doctor MBBS can volunteer themselves for providing safe motherhood service is called Vande Mataram scheme. A 2-year-old child is presented for vaccination. Which of the following vaccination, which have never been vaccinated earlier, was the universal immunization program? Which among the following vaccines will be administered to the child on the first visit? So we cannot give BCG after 1 year. So we'll give DPT and measles. So hepatitis B, I have a doubt about it, because what is written in Park's textbook is that the pentavalent vaccine cannot be given after 1 year of age. So DPT is usually can be given till 7 years of age, and measles till 15 years of age. So we'll go with answer 2 and 4. Consider the following statement which are correct. In the national immunization program, BCG vaccine is given only on left upper arm. True. It is done to maintain uniformity and for helping surveyors in verifying receipt of the vaccine. True. The answer is A. You visit an industry to audit whether the benefits under the Employees State Insurance Act are being properly provided. What is the following benefits should be available to the insured persons or other dependents of the case may be? So medical benefits, yes. Sickness benefits, yes. Funeral benefits, yes. Rehabilitation allowance, yes. So answer is 1, 2, 3, 4. Among the following intrauterine device, which is the second generation IUD? So second generation are copper containing copper T200, copper T380A. So 2 and 4. Danida, International Aid Agency of Denmark, known for its assistance in South India's National Health Program. So Danida has helped for blindness program, TB program, and leprosy program, but it is mostly known for its blindness control program with the 3-phase strategies. So we'll go with National Blindness Control Program. After attending a birthday party, in a house of around 50 students reported having loose stool, fever, and few reported vomiting. Outbreak can be identified as common point source only. First, there is one source, and only from that time they are having symptoms. So the following vaccines are given through intramuscular route: hepatitis B, pentavalent, and inactivated polio vaccine. So BCG vaccine is given intradermal. Covaxin is an inactivated whole virus vaccine. Which of the following agencies are playing a key role in running of the COVAX initiative against COVID-19? That is Gavi, WHO, and CEPI. So answer is 1, 2, and 4. So with this, we have completed all the answers for 240 questions. So check yourself how much you have got, and if you want, you can share it in the comment section as well. And if there is any mistakes in this paper, please let me know. We'll correct it. And so it was good discussing all the 240 questions. So hopefully everyone will get a good score and will be called up for the interview. So that's all for today. Don't forget to subscribe. Thank you.